This is the New Hampshire Breast and Cervical Cancer Program Billing and Claims Overview. My name is Kristen Goodrow. I am the New Hampshire Breast and Cervical Cancer Program Data Manager. This slide presentation and billing overview is intended for site coordinators, providers, and billing people. The objectives of this billing overview: how to submit claims for breast and cervical cancer program clients, understanding the billing process, facilitating billing for BCCP clients going on for services outside of your facility, what to do if a client receives a bill or is in collections, understanding the billing process for clients and with other insurance, understand billing process for BCCP Medicaid clients, understand our covered CPT codes and how to find our list of covered CPT codes, and understanding our site reimbursement rate for our site coordinators enrolling BCCP clients into our program. How to submit claims for BCCP clients. Claims for BCCP clients must be submitted to us on a HCFA 1500 form or a UB form. Claims can be submitted to us the following ways. They could be faxed, emailed to our secure billing address, or mailed to myself. Here's an example of a HCFA 1500 form. BCCP billing process. Claims must be submitted to us for actively enrolled BCCP clients. A client's BCCP enrollment is valid for 12 months, and clients should re-enroll yearly. Claims must be submitted with our covered CPT codes, and service must be breast or cervical related. Clients need to be enrolled in BCCP, and we must have data in our system for the services being billed. We cannot pay claims without having the corresponding data. The BCCP site coordinator is responsible for submitting data to the state BCCP office. The BCCP has over 144 active vendors, in addition to our screening sites, where clients may receive services such as laboratory, mammography imaging, facilities, hospitals, pathology, and radiology. Our BCCP vendors have a signed provider enrollment agreement that accepts our CPT rate as full payment for services, and the client cannot be balance billed. Claims should be submitted to us in a timely manner. Occasionally, we know things happen, and we can retroactively pay claims under special circumstances. Facilitating billing for services for BCCP clients done outside of your site. Consultations, labs, diagnostic imaging services are just examples. It is the site coordinator's responsibility to make sure claims for BCCP clients I'm starting over right there, sorry. It is the site coordinator's responsibility to make sure claims for BCCP services done outside your facility are sent to the BCCP state office for processing. It is very important that vendors outside of your facility know when services they're performing are for BCCP clients. We do not want our clients to receive bills. If a BCCP client receives a bill or is in collections, it is the site coordinator's responsibility to contact the facility that client received the claim from and have that facility submit the claim and or claims to our BCCP state office for processing. Site coordinators can email me if they want to make sure claims may be paid or if the service is BCCP related. Again, it is very important for site coordinators to tell clients if they receive a bill or on collections to notify them immediately. The billing process for BCCP clients with other insurance. BCCP is always the payer of last resort. If a BCCP client has other insurance with a high deductible or coinsurance, claims should be submitted to the client's primary insurance first. At that point, the claim should then be sent to the state office with an explanation of benefits, EOB, attached with the claim so I can process for payment. Billing Medicaid process for BCCP Medicaid clients. If a client is diagnosed and enrolled in BCCP Medicaid during the client's BCCP Medicaid coverage period, all claims should be submitted electronically to Medicaid. If we inadvertently receive a claim for a BCCP Medicaid client, I will deny that claim and or notify the facility stating that that claim and or claims should be submitted electronically to Medicaid for processing. We have our covered CPT codes and where to find them. We have over 100 covered CPT codes reimbursable through the Breast and Cervical Cancer Program. The Breast and Cervical Cancer Program reimburses at Medicare rate. A list of our covered CPT codes and reimbursement rates are updated yearly on July 1st. You can find a list of our covered CPT codes and reimbursement rates at this email website address. Here are just a few of the services we cover: evaluation management, pathology laboratory, radiological, and surgical services. Reimbursement for site coordinators enrolling BCCP clients. BCCP will reimburse site coordinators for their time enrolling BCCP clients. To be reimbursed, we must have at least data for one paid service in our system. BCCP reimburses site coordinators using CPT code G9001 for $180 per client enrolled with one paid service. The state office runs this report monthly for payment. I will then enter that for payment. Accounts payable sends a check directly to the screening site monthly. We do have a few screening sites who chose to bill state BCCP differently, and they submit invoices to the state monthly. Those sites that chose that other option are not eligible for the G9001 reimbursement. Thank you for your time. Below is my email address and contact, as well as our website address and the information we have on there. Thank you.